let's look at how we can use ReallyWrite to actually edit your text. Now, we start using ReallyWrite when you're in the revision stage. You've already done your writing plan or your outline, you've already written out your rough draft, and you have all of your ideas in roughly the right logical order. Now you want to start looking sentence by sentence. You want to start removing wordiness and making sure that the flow is right. This is where ReallyWrite can help you to see some things that you might not notice without it. So let's take a look at the example text. Here we have a short paragraph from an introduction. When we scan over this text, we see there are quite some colors. The first sentence gives you some purple underline, which tells me I have a list of prepositional phrases. Preposition, noun, preposition, noun, preposition, noun. The second sentence is not underlined at all except for the passive voice. The third and fourth sentences are both orange, telling me that they're complicated. I have some wordiness here in the blue, and I have some passive voice there in the pink. Now, as I go through and I revise this sentence, I'm just going to notice the colors and see if by noticing the colors, it leads me to look more critically at those parts than I would otherwise do. Now, if we look at this very first sentence, we have acute hyperglycemia is. There you've got your subject and your verb close to the beginning. It's really nice that we start that way by naming the disease, naming the problem at the beginning of the introduction. So it makes a lot of sense to start that way. Is a prognostic factor. And then we have for mortality in critically ill patients, either in the presence or in the absence of diabetes mellitus. Now that end of that first sentence is really long and heavy. If you didn't notice it was long or heavy by yourself, then ReallyWrite points it out for you. It says, hey, look at this. It's underlined in purple. Is there anything you can do there? There is. Usually when I see a situation like this, I want to look for the verb that shows the most precise relationship. So here, what's going on with mortality? What is acute hyperglycemia doing to mortality? What's the relationship? Well, we don't actually have to have all of this wordiness here. We can actually just use the verb predicts. We don't have to say prognostic factor. Here we do this. Acute hyperglycemia predicts mortality. And now we need in which situation? Okay, in critically ill patients, clear. Acute hyperglycemia predicts mortality in critically ill patients. But then we have either in the presence or in the absence of diabetes mellitus. Now you might look at that and you might think, oh, but there's nothing else I can do here. Well, actually there is. There's usually something else you can do. What usually prevents us from changing things is that we don't know what else we can do. There are some patterns, though, that you can follow when you're revising in this way. And one pattern to follow is look for the verb, the precise verb, and create a subject-verb relationship focused on who is doing what is the main thing in the text. In this case, it's acute hyperglycemia. But what could be the main thing in the second part of the sentence? In critically ill patients, do you think that the patients might become the main thing, that the patients are the most important thing here? And if we notice that, then we can create an either-or relationship that's much less wordy, that's focused on the patients. You could say whether or not they have diabetes mellitus. So now you have a much shorter sentence. You have a subject, verb, object relationship, and then you give me details about what kind of patients. And then you have a new relationship here with a new subject. Those are the patients, the critically ill patients, and then a new verb, and then a new object. So a pattern that we're trying to apply in order to get rid of many of these colors is subject, verb, object. Find what the sentence is about, then find the verb that shows the clearest relationship. And if you follow that pattern, it can really help you to revise your sentences in a way that you might not have thought about before. Now, I think I'm happy with this first sentence, so let's go on to the next one. The benefit of strict glucose control in the intensive care unit was demonstrated by the Leuven study. Okay, When I see this sentence, I'm noticing that we're starting with new information that hasn't been introduced yet, the benefit of strict glucose control. Not only are we starting with new information, we're starting with an abstract noun here, benefit, which is not something I can really hold on to. So abstract noun, new information at the beginning, then we have this passive voice verb, and then we end with, here's this study, but look, we're naming the study here. Oh, and then we're also probably naming it, it's either 4 or 5 or both. We're naming it double in this sentence. So when you have references, you can think about going in two directions with them. One is that you leave the reference at the end of the sentence, the 4 or the 5, and that's enough. You don't have to also say the reference, the study, in the sentence. You don't have to double up on that reference. That's the first way. The second way is maybe you have a reason to really emphasize that study because it's the most important groundbreaking study and you're going to be naming it a lot. In that case, you can put it in the sentence, of course, but we're going to make sure that it's not at the beginning of the sentence. It's not in the most important place in the sentence, like the topic position or the main verb. What you can do here is we can look at how do we connect the information in this sentence to what you've already given me? What could be familiar information? This is hard because we suddenly, between the first sentence and the second, we have this gap, we have this jump. You told me something about acute hyperglycemia, that it predicts mortality, whether or not they have diabetes mellitus, but then suddenly we're shifting to the benefit of strict glucose control was demonstrated. Well, the first thing that I would do is I would take this information that's new and I would think, how can this go at the end of the sentence? Okay, strictly controlling glucose. Let's try something like this. Strictly controlling glucose in the intensive care unit. And here you say that there's a benefit of it. But actually, what I would want to do is I would want to know, well, what exactly is the benefit? Can we not be vague, but can we be more precise? How does strictly controlling glucose help those patients? Well, after discussion with the author, I learned that it improves patient outcomes. It improves patient outcomes. So now we have the benefit, but we actually name the benefit more precisely here. We give the action strictly controlling glucose in the ICU improves patient outcomes. And we know this, why? Thanks to this study. I'm going to leave that study at the end for now because I still don't really have a connection. Here it looks like the connection could be that this is information that we now know that we didn't know before that study. So this is more recent and that we're really emphasizing that now we know this. There's actually an easy way to start this. You can simply say, we now know, or you can say we know now, that strictly controlling glucose improves patient outcomes. And why do we know that? Thanks to the Leuven study. Now, this is what you can do if you really want to name that study within the sentence. But you could also take the other route and you could just remove the name of the study from the sentence and you could just put a reference there. And then you wouldn't have to say we now know or we know now. Or thanks to the Leuven study, you could just say, if we strictly control glucose in the ICU, then patient outcomes improve, reference. And that's another sentence structure that you can use that gives the same information. So here I'm proposing some different ways to write these sentences, but there are always other ways. There are many different options. These are just the options that are coming to my mind at first glance. However, different options might come to your mind, and it's usually a good idea to come up with multiple different options to really explore how many different ways can I say this? And then when you've got them all out in front of you, you can look more objectively at them and see, oh, well, this one is better than the other one because, and then you can end up choosing the best option for your situation. Now let's go on to the third sentence. This sentence is orange, so it's complicated. we're not going to remove all the complicated sentences in our writing. And usually for me, I like to keep a rule of thumb that I allow myself 1 or 2 complicated sentences per paragraph. I try not to have more than that, unless I have a big exception and I'm working on a text that has a lot of really big words and there's not a whole lot I can do with that. However, there usually is enough you can do to limit your complicated sentences to 1 or 2 per paragraph. And then I also try to have white sentences in between the orange sentences. So I try not to have 2 orange sentences next to each other because that's really heavy. Sure, a reader can absolutely deal with an occasional orange sentence. Yes, we can handle that, especially if we've got a lot of white sentences around the orange sentence. A little bit of extra work, okay. But once you get to a lot of extra work, it becomes really hard to process what information you're trying to give us. So let's look at what makes the sentence complicated. Well, we've got a green here, underline, under reduction. That tells me that it's a zombie noun. Here it says reduction may be a zombie noun. When you've got a zombie noun, it is highlighted. Yeah, you look at that and you decide for yourself, is this a zombie noun that I can actually change back into a verb? There's a nuance here. Notice it says reduction may be a zombie noun. You could try reduce instead. And sometimes this will be really helpful. You'll say, oh yeah, in this case, it is a zombie noun. I actually want that to be my verb reduce. And in other times you'll say, oh no, actually, the way that my argument is flowing, I need to use the noun here. And it's familiar information. I used reduce above and now I'm referring back to it. There's a reason for me to use the noun here. And if you do have that situation, then you can just click the ignore button. And if you have a situation where a zombie noun is one of your key terms in your text, then you can just ignore that key term everywhere, and that gets rid of the color for you so you can work on the things that actually matter. Now, at the time that I'm making this video, ReallyWrite is not actively using large language models unless you choose to sentence by sentence. And mostly that's because of privacy, but also because ReallyWrite is intended to be an educational tool to help you learn to think about your writing, and it doesn't do the work for you. So you actually have to decide, is reduction a zombie noun? Do I want to change it here? Or do I have a reason to leave it? Now, some other things that I'm noticing, besides the zombie noun at the beginning of the sentence, that's also an abstract noun at the beginning of the sentence, is you've got a couple of passive voice. All right, what can we do with this? Here, I want to start with human or concrete subjects whenever possible. Here, I've got an abstract subject and a zombie noun, so I've got to figure out, who is this sentence about? I think this sentence is about patients. I think we're talking about patients who were treated according to a protocol that aimed to achieve normoglycemia. I think that is the context of the study. What if we start like this? In this study, patients were treated according to a protocol that aimed to achieve normoglycemia. That's a first sentence. We've got in this study, and then we've got a subject, patients, a verb, and then an object, kind of what happens at the end of the sentence, and then we stop. But there's more in this sentence than just the information about the context of the study, right? There's the result. It makes sense to me that we first say the context of the study. Here's what the study did, what they looked at. And after that, you tell me what happened with these patients. So I would actually want to make my next subject-verb-object structure after the context. And now that I've started the sentence by saying patients, I can perfectly well continue with patients. Well, what happened with these patients? They had reduced morbidity and mortality. If I do that, then I can get rid of remarkable reduction in morbidity and mortality was achieved in. I can get rid of that from the beginning of the sentence. And I can have, in this study, patients were treating according to a protocol that aimed to achieve normoglycemia. Here you can do a comma and they had reduced morbidity and mortality. You can nuance it. They had significantly reduced morbidity and mortality, and here maybe it makes sense to nuance it because you had remarkable in the first sentence. So this is one way of doing it. It's still orange, but the sentence is now about patients and patience. And the structure is, let me tell you the context of the study, and now let me tell you what they found, what happened to the patients. You can leave it like this, or you can make it 2 sentences and put a period here and get rid of this and, like this. If you make it 2 sentences, of course, it's going to get rid of the orange. So you have to decide, does it make sense to put this together in a single sentence? Are these ideas closely related to each other? Does this help the reader see the relationship between the sentences by putting it together? Or are these about 2 completely different things and they can be in 2 different sentences? Here, I'm going to leave it together for now because it's the context and then the results of the study. It makes sense to me that we would leave them together. Even though this sentence is orange, I'm still going to leave it, but I've revised it. I've looked at the fact that it was complicated. I've looked at the structure. I've noticed some things that make it hard, and I've tried to reduce those things that make it hard. And yeah, maybe that didn't stop it from being orange, but that has improved its readability. All right, now we look at the next sentence. Thus, the logical aims of glucose control, notice here again the abstract subject in the topic position, are to eliminate hyperglycemia as rapidly as possible and to maintain normal glycemia from then onward while avoiding hypoglycemia. Here we've got some nice parallelism, to eliminate and to maintain. However, we have another orange sentence. Let's see if we can do something with this sentence to reduce the wordiness, to make it a bit lighter and easy to read. The logical aims of, normally an aim I can put in a verb. So what if I removed this abstract noun from the beginning and I made the subject glucose control? Now the sentence is about glucose control, which is, hey, what the actual research is about. This is one of the key words in the research. So it makes sense that I would talk about glucose control in the topic position. Now I want to give a nuance that tells me about the aims of it. Here I could use a word like should. Thus, glucose control should eliminate hyperglycemia and here we can remove as rapidly as possible. In discussion with the writer, that was unnecessary. And maintain normal glycemia. We can remove from then onward while avoiding hypoglycemia. And here we can actually add a little bit of nuance. In discussing this, we first had avoiding hypoglycemia, but there was a little bit more nuance there. We might think about minimizing the risk of hypoglycemia. Thus, glucose control should eliminate this and maintain this while minimizing the risk of this. Now, this sentence is still orange. Okay, it's still orange, but I edited it. I paid attention to it. I changed the topic position so that the topic position could be the key word of the text. I got the verb there, eliminate, maintain, and minimize. I've got 3 active verbs. I could split it up if I want to, but I think that while minimizing, they all are related to each other pretty well. So in this case, I might also choose to leave it. Now let's look at the final sentence. Although this, there's an empty this right there, this what, because there were 3 things happening in the sentence before. Although this represents a clear goal for algorithms, there's no clear way to assess the performance of such algorithms. Now we're suddenly introducing the idea of algorithms, which we'll get into later in the text, but we weren't talking about that before. Now, when we looked at this text to revise it, seeing that sudden, now at the end of this first paragraph, suddenly we're introducing algorithms, but there's actually another point to this sentence, the author decided, I'm actually going to introduce algorithms in the next part, and right now the main thing that I want the reader to remember is this. There is no clear way to do what? In this case, they chose to connect back to evaluate the quality of glucose control in the ICU. And as a concluding sentence for the paragraph, this one brings us full circle. And then the next paragraph can get into what kind of algorithms we can use. Now here, if I make this a capital letter, then we would see that the sentence is no longer orange or red. It's just a nice, simple white sentence. And here we can add a little bit of nuance here. We can add, for instance, there is currently no way, no clear way or no way to evaluate the quality of glucose control in the ICU. And now we're setting us up to solve this problem, to answer this implied question. How do we evaluate the quality of glucose control in the ICU? Notice in my new sentence, there's a wordiness underlined with there is. Normally, we try to avoid starting with there is because normally we can completely remove it and make a sentence with a more precise subject and verb where the subject refers back to what we were talking about just before. However, in some cases, it can be helpful to use there is or there are because it allows you to push the new information or the information that you want to stress into the stress position at the end of the sentence. So here I see that this is highlighted in blue. I might look at it and ask myself, is there any other way for me to do that? Is there an easy way for me to do that? Is there some really easy, familiar information that I could put at the beginning of the sentence here? But sometimes there's not. And if you want to help with it, you can always click on this link. So if you click on this blue, you can click on the link and you can get some examples of how you can remove this kind of structure in different situations. And that might help you to think about what you could do in this situation. For me here, I'm going to leave it. So here, we've gone from 20-something to 49. So we've really increased the readability of this small paragraph. We kept the two orange sentences orange, but we revised them. We didn't just leave them alone. Yes, they're still orange, but they are clearer than they were before. And if that really bothers me, if I think, I really don't like that, this first sentence is an easy one that you can cut, but you don't have to. You need to choose for yourself. Does it make sense for me to put those two sentences together? Is it not too heavy when I'm looking at the whole paragraph as a unit? Or do I want to separate because it is too heavy? That's not a decision that any algorithm can make for you. You can superficially increase this clarity score by making a bunch of short sentences. Notice how when I cut these two sentences in half, the clarity score jumped from 49 to 65. And now you're in this beautiful blue color and you've got a nice smiley face to motivate you. However, that may or may not be the best solution for this situation. So please don't feel forced to make artificially short sentences if it doesn't make sense to make short sentences just to get a higher score. You need to make revisions that make sense to you, that make logical sense, and that fit with what you are trying to say. And that doesn't mean that you're going to get rid of all the colors. You won't. You'll get rid of some colors, but look, we've left one, maybe two complicated sentences. As I mentioned before, my rule of thumb for myself is 1 to 2 orange sentences per paragraph. That's fine. I usually try to avoid all red sentences. The only time where I will accept a red sentence is if, for instance, I have a long list. I have a very simple structure and a long list. I can't do anything with that list. It has to be there. The words are long. They have to be long. But the structure surrounding the list is extremely short and simple. Then I know that there's nothing else I can do there. I just have to accept that that one will be red, for instance. So if you have a number of complex words in a sentence, yet the structure surrounding those words are really simple, you might occasionally end up with a red sentence that you can't really fix. And in that case, you also just accept it. You say, okay, then once I have a red sentence, all right. Now the passive voice is here to point out where the passive voice is so that you can use it consciously. It doesn't mean that you have to get rid of every instance of passive voice. Passive voice is useful. And what's interesting is if you click on this, you will read that the passive voice is really useful, but the passive voice is a tool that should be used wisely and carefully, and that there are reasons to choose for the passive voice, and you can read about them here. So it is valid for you to choose the passive voice as well. Now, if we go back here, we have one passive voice left. That's fine. This passive voice allows me to put the patients in the topic position. That's helpful because then I have humans, the main players in the research, in the topic position. I don't have any long lists of prepositional phrases anymore, so that's great. I removed the wordiness and the list of nouns. I got rid of all my zombie nouns. Usually you won't get rid of all your zombie nouns because some zombie nouns can be helpful. I don't have the unclear pronouns anymore. This is the word this by itself. I do still have the 3 examples of wordiness because I've chosen to keep whether or not, eliminate as a bit of a long word, and that there is structure at the beginning. So that's okay. On the whole, I would say I don't have as many colors as I started with, even if I kept these 2 sentences together. So I have improved. I hope that this video has helped you to see what ReallyWrite can do for you, and what you need to think about yourself, the decisions that you need to think about yourself to make yourself as you're working through your text. Something that is also interesting for you to look at is down here. You have a word cloud that helps you see, as you put your text in, what are the most commonly used words. And then you want to see here, are your keywords really popping out strongly in this word cloud, or are some other wordy things popping out? So you can keep track of, am I being consistent with my most important keywords? Or am I using a lot of different words to refer to the same thing? That can be easier to see with a word cloud. And the word cloud is more interesting when you copy and paste more text in. Good luck with using ReallyWrite.